everyone who had a membership to that gym showed up at the same time, you wouldn't be able to work out.
There's one I'm thinking of that everyone's like working out now here. And they're like, oh, I go here. Do you go here? And I'm like, I think everyone goes there. Like, can you even get on the equipment or the recovery stuff that everyone has now added?
It's just, and I just think as a principle, like I own a gym and like, why would I structure my business around hoping that they don't come to the gym? Like in my head, that just doesn't make sense. Like I want people to have a gym membership.
Well, that's because you want to make a relationship with each person that walks in and you care about all of your clients. And wait, I want to say patient, all of your clients versus like the Globo gyms, they're a business. And that's what it's the same thing with the traditional PT clinics. Like they're a business. They have to, we all have to make money to operate, right? But like, there's a difference between a mom and pop coffee shop and like Starbucks. Yeah. And we can all feel that. And you feel that when you go to those Globo gyms.
Welcome to Beyond the Reps, where we talk about all things your physical therapist and trainer forgot to tell you. I'm one of your hosts, Whitney Stevenson. I'm a gym owner, a celebrity trainer, and a personal training coach.
And I'm Dr. Hanna Shays, your co-host. I'm a physical therapist and practice owner.
So this episode, I guess the intention is to give you guys just a little bit more insight into what it is that Hanna and I do at SonMade Fitness, which is the physical location that we both work at. It is my personal training studio, boutique gym. Hanna also has part of her practice there. Yeah.
So I remember... it was a year and a half ago. It's been almost 2 years since I reached out to you because it was August 2023. Yep. And I found your gym on, I guess, Google Maps. I was looking for like another space to add that was more west in Jupiter. And I emailed you. I didn't DM you.
No,
I emailed you. So formal.
Big girl email.
So professional. I emailed you and I was asking like, hey, do you have like room for some type of table setup that's not in the middle of the gym? Can I come see the gym? And then we met and
here we are.
I gave you a little service, but you had someone else in the space. But that was almost 2 years ago.
Yeah.
I finally made my way in 6 months later?
It was not too much after that. And originally your business was mainly mobile, and you still do mobile service.
I do. I would say I probably do mobile like twice a month now. Like there's some
so
people
you've like super trimmed down on that.
Oh yeah. No, I have someone I'll go out to the acreage and see just because it's the acreage and it's west on North Lake. But no, like I was purely mobile, and I was probably like 70% mobile when I reached out to you 2 years ago. And it's just been really, you can't see more than 5 or 6 people a day.
Yeah, you can't.
Mobile, it's not possible.
I mean, it's hard to see that many people when you're spending 60 to 90 minutes with them in person without the 30-minute commute.
Yeah, I would have to gap 30 minutes because really no one lived in the same neighborhood. Like sometimes I'd be driving 20 minutes and I could not see more people. So we had to trim down to location only, which is way better for me anyways.
Yeah, it kind of gives you at least days and also different exposure to different kinds of people, which is great. So, right, how many days at the gym are you right now?
Well, I would be there 5 days a week if people lived in that area and there was demand for that area, but I have people kind of all over the county. So right now I'm in the gym 3 days a week. Yeah. Like I'm really there Tuesday, Thursday, Fridays.
Yeah. And then Sundays we come and sweat at the community class, which is great. So if you want to see him,
sweaty.
3 days a week at SonMade, or just come visit us on Sunday. Get a good sweat going.
Sundays at SonMade.
So, yeah, I mean, just diving right in, this is really a conversation I've been wanting to have because I was inspired from listening to another podcast the woman was a psychologist, and she was talking about basically she created a podcast to like reach more people, right? So in this podcast, I can't coach more people, but I can give you insight to what we do and maybe a little more access to some things that are going on. So if you were ever interested in becoming a SonMade Fitness client or a client of Hanna's, like this is kind of why and what goes on behind the garage doors, why we chose to work together, why we're bridging the gap between physical therapy and personal training. And we're going to kind of get into the nitty gritty beyond the reps with all of that. or going beyond.
And I think what I want to accomplish and convey in this episode too is I've had people ask me at injury screens, or they were my patients and they didn't have a trainer yet, and they would say, should I just get a personal trainer? And I think part of the answer to that question is sometimes it's like, well, yes, you should, but it's not just, go on Google and just find the nearest and the cheapest one. It's not all training is the same. And that's what I hope we can convey with this podcast about SonMade. And then also people ask, do I need to get therapy? And again, the answer is like, well, yes, therapy can be good, but it really matters who you work with therapy and training. It's the person working with you that is going to make the difference, not just the action of personal training or the action of going to your therapy appointment. So hopefully we can shed some light on what makes us different and unique in the area that we're in Jupiter, Florida.
For sure. And I think too, we'll get into this like a little bit more in depth, but a lot of people, you know, when they're figuring out, should I go to therapy or should I get a personal trainer? Yes, the answer is usually probably yes. You need to get the right one of both of those. Personal training is a little bit separate because I'm not handcuffed by, oh, well, I have my insurance pays for this, so I'm just going to go with this person. Yeah. So where, you know, I interact with a lot of clients who, you know, I recommend to you, or, you know, even just people like that I know are having a movement issue. And it's sort of like the insurance veil goes over their face. Like as soon as I'm like, oh, I have a physical therapist, I know.
This is healthcare. So I have health insurance.
So then it just becomes like, it doesn't become part of like their wellness or their fitness or their health. It is like looked at as this, well, what does my insurance help me get? And it's not always going to help you get the best quality treatment. And it's not always going to make you better, unfortunately. So let's go with like a brief intro. SonMade Fitness is the gym that I own. And I opened this space because I really value individual coaching. I value custom programming. I value your whole life being considered when it comes to your health and your fitness. And at SonMade Fitness, we really want to preserve your movement and keep you as healthy for as long as possible. We kind of joke we're like the worst hour of your day, not because like the training is so horrible or because the gym is, you know, a gym, but because it's the worst hour of your day because your life is so amazing outside of the gym. Like you get to go and do all these cool things. You have a healthy, capable body to lift your paddleboard up or to do these, you know, awesome things in the community. And, you know, with that, with having this awesome body and life, you get personal training, customized training workouts, professional level coaching, conversations that are, you know, not just basic, but are actually addressing maybe like some of your lifestyle needs or some habits that you need to change. And that's kind of like a brief intro to the mission that I have with SonMade Fitness. And then Dr. Hanna comes right along with everything that she does in helping people move like functionally sound. Do you want to share a little bit about like the overlap we have?
So with my practice, especially in Whitney's space, I like to look for the root cause of people's issues. So I think that's what differentiates me as a provider in the area. I think a lot of people will go to physical therapy and be like, well, I have pain. So now I'm going to address it. And pain is actually what you feel last. Like all of the breakdown of your biomechanics and the soft tissue injury, people can be asymptomatic until they feel pain. And then they go, oh, I have a problem now. And honestly, most of us have a problem before we feel the pain, but who wants to pay for wellness and, you know,
or they think the problem is the pain, not, well, you're bending a certain way or your knees are doing a certain thing and that's what's causing it.
The problem is the pain, but not the thing that caused it, when really the thing that caused it is the pain, which is the root cause, which is like what over time. After.
It was like, well, I bent my knees like this since I was 13 and why didn't I have pain then? It's like, well, because over time you have worn down, you have developed this thing, and now your referred pain is, you know, what you're experiencing
from the breakdown of the tissue. So we really go into the root cause of the pain and the issues. A lot of clinics will just treat the symptoms. And honestly, that's what they teach us in physical therapy school. They'll teach you what you need to know to pass your boards. So they'll be like, okay, you're going to learn about rotator cuff and labral tear and like all these different conditions, and you can apply XYZ treatment to this condition, which is kind of like, I mean, that's Western medicine. That's like when you go to the doctor's office and it's like, oh, you have this problem, here's a pill.
It's so interesting that in PT school, you're getting taught almost to ignore big picture, what the body is doing, how the body is functioning as a whole, to zoom in on basically maybe the one area of pain that this person is having.
Yeah, I think it's kind of like drinking through a fire hose with school, where it's like, you have to know all of these conditions. You have to know all these treatments for the conditions. You have to know all these conditions to rule out. It feels more reactive to, the patient that's sitting in front of me with shoulder pain. Well, I know these shoulder exercises and these shoulder stretches, but a lot of times shoulder pain comes from the thoracic spine.
Exactly.
And I was in school, like, basically, almost 10 years ago. So we learned that it can come from the thoracic spine, but the application isn't really there. Like, really, school teaches you how to pass your boards. So you're just like, I can just study and pass this test. And the application is kind of limited because we're in each rotation for like 2 months.
Interesting.
So you might be in an outpatient rotation once or twice before you graduate and only have 2 to 4 months of like applicable experience in a clinic. And then you're focused on this paper test or this online test, and then just getting through that then learning how to maybe be a better clinician. But now the insurance clinics are just overloading people, like those mill clinics where you see a therapist and they evaluate you, and then maybe you have a therapy assistant see you or a technician, and it's really busy. There's 3 other patients that are seeing the therapist in that 1 hour time slot because the insurance reimbursements have been cut and they have to load up patients in the clinic.
Oh, so you're sitting there with heat or ice and stem
or on the bike.
Yeah.
Like
which is so crazy to me. Like, you're going to physical therapy to sit on a bike or to lay. I just, it's therapy. It's actual, it should be therapy. It should be something therapeutic that you are getting better through.
Well, the ice and the heat, I think that's part of that old like acronym that we learned in school, like RICE.
Yeah.
Rest, ice, compression, elevation. It's like, oh, well, we'll just put ice on it. Oh, well, we'll put them on the bike. The bike is actually, I feel like the bike is really just a trick so that they can have you doing something while they attend to someone else. It's not a personalized attention. It's like a fluff. And then you can bill insurance for it.
But it also is, I love the bike. It's probably, I'm assuming it's something like a Schwinn or an assault bike that has arms, so you're moving.
No,
it's just
no, it does have arms, but it's a new step. It's a recumbent bike.
Oh my goodness.
It's a recumbent bike. No, it's not, they don't have assault bikes in like most
because
insurance clinics.
The assault bike is really good, not to go fast, but to go easy. It generates a lot of blood flow. So like when I was competing, I would specifically use an assault bike for a warm-up because I knew it was helping generate a lot of blood flow.
Well, and that's the difference between someone like you and the normal person who goes to the clinics I was just describing that do the new step and the ice. So the people at these clinics tend to be a little, I don't want to say sicker because I'm sure some of the people listening are like not sick and they might go to these clinics, but there's a lot of less well people that will use their insurance and the doctors will just refer them there, and they'll be older and have back pain or weight issues or something. But people like you tend to know more about these private practices like the one that I have, and you're like, I'm not going to that clinic. I feel like a lot of therapy clinics are basically like the assisted living facility version of a gym. Where everyone's just slowly working their way into like hospice care at the gym.
Like to more.
But it's just like, oh, we're going to lay here and do stuff. We're not going to lift heavy weights. Oh, here's your ice pack. Like, are you feeling okay? Versus people that I work with and like you that come seek out non-traditional physical therapy, you're looking for things that match your lifestyle and your training style.
For sure.
The traditional clinics cannot usually accommodate that.
Yeah. And I usually, and this is, I think, a side note now that I do, because I work with people, I coach people, I genuinely try to make them better, and I own a business. So I know how I interact with people and how I interact with my client. So if I'm ever at a facility or a clinic where I'm witnessing a 3-minute interaction between a doctor and a patient, and then I'm going, there's not enough information. I can't look at somebody for 3 minutes and know how to diagnose them in their movement. Like, I don't know how a doctor could officially say, I could see you for literally 3 minutes and diagnose you and be done with you and on to the next person. Like, to me, I mean, even 15 is pushing it. Like that's way too little of time. And I see people move all the time, and I'm constantly looking at like how to make them more functionally sound so they can get stronger, healthier, better, etc.
How long are your movement assessments?
They're at
like
least
your
an
first
hour.
session?
At least an hour, and they usually go to like 75 minutes.
Yeah, mine are 75 minutes too.
I mean, it depends. Like the client may have to go to the bathroom in the middle of the thing. So sometimes things take longer, but yeah, I mean, they're at least an hour. And even in that first movement assessment, I let the client know like, hey, like this relationship is going to evolve. Your training is going to evolve and look a little bit different in the upcoming, like probably almost up to 5 weeks. And right around after 5 weeks of maybe, say this client's doing 2 sessions a week. So now I've gotten 10 sessions with them in. Right around after 10 sessions, which is me spending almost 10 hours with somebody, maybe a little bit longer, 10 to 12 hours, I feel a lot more confident in writing them a program. But like, I need to get to know them. We need to be talking. I need to know their lifestyle. I need to know if they're sitting all day. I need to know if their dog just died. Like there's a lot of things going on in people's life that can affect their training and like their performance and their goals and just their overall, you know, like habits of health, and that I want to be able to address them as best as I can with that training session. And that takes time. It takes time to get to know someone.
Yeah. Like we both will tailor our sessions to whatever the person in front of us needs, where they're at versus, oh, I have 5 shoulder patients today. I'm going to do rotator cuff strengthening. I'm with bands. Like it's going to be totally different based on what each person needs. And I can see that with the way you train people too.
Yeah, for sure. I think that's kind of why we both get along, and like both of the design of what we created is like your physical therapy, you're treating a human, you're treating the person. And like my gym is training, and it's training that's built around a person, not around a trendy fitness thing, but like the training is built around the
fitness trends.
Yeah, the fitness trends.
They hurt me so bad in my heart.
They hurt my soul. But yeah, it's training that's built around that person. So we can kind of talk about the environment that we both create. We have like a little bit. So
like when we share a patient,
when we share, but also just like, you know, the settings that we create. So in SonMade, like it is, I actually will say it is a little intimidating. I've had people come into my gym and be like, oh my gosh, what is that? Because I have like a big
because there's no machines. You have no machines, and machines are really easy for anyone to just kind of like mess around with.
Sit down and hide.
Or just kind of like guess or look at pictures and like you don't have to know really what to do.
Yeah. I also
can't do that in your gym.
And I don't have mirrors. I don't have mirrors for a reason. Specifically, I mean, there's a mirror in the bathroom. Calm down. You can look at yourself in the bathroom. But, you know, and on the gym floor, I really want the coach and the client to be in tune with like what their body is doing, to feel the difference. Because when you're out in life, you're not like picking your groceries up, looking in the mirror, like checking out your form. You're not lifting the dog food out of the bed of your truck.
If grocery stores had mirrors, we would never be able to leave.
Can you imagine?
I would be stuck waiting for people to get out of the mirror.
Waiting for people
Excuse
to move.
me, I need to go to the produce aisle.
Yeah, so I mean, I think that's a little bit of what's different. Like I don't have your traditional Globo gym atmosphere. Like you're not coming in, there's not, you know, isolation stationary machines. I do have aerobic machines like assault bikes. I have a runner. I have rowers. I have the whole gamut of concept too. I have the ski. I have the ski erg, the rower erg, and the bike. I have fitness pieces that really rely on you to make them move.
Understanding your form and your body versus the machines. You can angle them so that I want to put in air quotes, forces the right muscles to turn on, which it doesn't always, but like we can't just rely on things to do stuff for us or put us in the proper position. Like we should learn how to move our body, like, and what that feels like.
In a functionally sound way. And when I'm saying functionally sound, I mean that in that it's a healthy way to move for as long as humanly possible. So you're going to be able to continue to bend your knees and to continue to bend over and to reach overhead, you know, well into your 60s and beyond, hopefully into your 70s and 80s. Do you have like, I don't know, a contrast of kind of like what you do, how you're on the gym floor versus like another clinic.
Versus
Like
like
you
a
just were
clinic.
talking about a little bit about how the clinics are kind of like these
Yeah.
assisted living facilities of,
gosh.
Therapy.
Yeah. So if you just imagine like an insurance clinic that you've been to, it's usually kind of busy, and there's a bunch of like tables, like plinths, these tall firm tables that people are on, and they might be on ice. There might be a therapist there having you lay down and do exercises, but not necessarily standing and doing the exercises. And standing is the most functional thing we can do, right? So you want to try and have people loading properly and being on their feet. There's also not a lot of time for manual therapy, like hands-on treatments, because if you're bouncing around from patient to patient, you only have like maybe 10 minutes to like do hands-on care with someone, and then you're bouncing to the next table. So the way I treat that's different is I'm in the loft. Sometimes I'm in the loft for the full hour with the patient. If they're in pain, we're doing a lot of manual treatments, like soft tissue release, sports massage, dry needling, cupping, Graston style treatment. And doing some education, like I'll use the wall up there if we're doing like a postural thing or a stretch, or we'll use the floor if we don't need a lot of space. And then probably some people will do 30 minutes up there and then 30 minutes down on the floor, where we're like, okay, your tissue's primed, we're ready to move, and let's use the weight, let's use the wall. I think really what I need is just a floor and a wall. And eventually I need weight to progress them, but floor and the wall can be like a wealth of exercises.
Yeah, they definitely are. And I think too, like having a sense of feeling like comfortable with you, like, oh, I don't feel weird about taking off my shoes. I don't feel weird about...
Oh yeah, I make everyone take their shoes off. I forgot to mention that. I don't let people, even if they're in barefoot shoes, I just need to see what their toes and their ankle is doing, if they're pronating too much or what that does up the chain. Yeah. And pretty much nobody gets away with wearing shoes for the first few visits.
I'm going to make this shoes off. No service, shoes off. Unless shoes are off. Yeah, I do think the gym, it should have like a comfortable environment to it. And not a lot of gyms have that. I think at SonMade, I really try to convey that this could be like your home. Like this is a fun and light and happy place, even though it's the worst hour of your day. And that I want people to feel comfortable there, because I do think that, especially for some people who, that maybe their first time moving athletically, or that maybe their first time they reached out about feeling unhappy with their body. And there's a lot of insecurity as far as when people are moving in a new way or a different way. And I want them to feel like a sense of safety. A client should feel like, okay, like I'm feeling vulnerable, but I'm still going to like allow myself to be coached, because I know and I trust that this person is helping me move towards a better, healthier, fitter future. Another thing is that there's enough space that people can lift and they can move weights. Like I have bumpers plates, I have sleds, I have tons of different tools for people to try. So if they have a movement limitation, I can adapt as a coach, I can adapt the programming and really try something different. I also have like a limited number of memberships. So typically if you go to, I don't know, let's just call it a Globo gym, because I don't want to call out any particular names. But if you go to a Globo gym, the way that their business is set up is they're guaranteeing themselves money, and basically by you not coming to the gym. So that's why the membership is so cheap, because they have like thousands of members that maybe they don't even know that they're paying $39 a month for this membership, because it's like a whisper in their bank account going away.
Well, there are people who know, and they're like, oh, I should cancel that. And then they just
And they never do. Yeah. And so like in that example, if you were at a Globo gym and everyone who had a membership to that gym showed up at the same time, you wouldn't be able to work out.
There's one I'm thinking of that everyone's like working out now here. And they're like, oh, I go here. Do you go here? And I'm like, I think everyone goes there. Like, can you even get on the equipment or the recovery stuff that everyone has now added?
It's just, and I just think as a principal, like I own a gym, and like, why would I structure my business around hoping that they don't come to the gym? Like in my head, that just doesn't make sense. Like I want people to have a gym membership.
Well, that's because you want to make a relationship with each person that walks in, and you care about all of your clients. And wait, I want to say patient, all of your clients, versus like the Globo gyms, they're a business. And that's what it's the same thing with the traditional PT clinics. Like they're a business. We all have to make money to operate, right? But like there's a difference between a mom and pop coffee shop and like Starbucks. Yeah. And we can all feel that. And you feel that when you go to those Globo gyms.
Mm-hmm. And it's definitely interesting too, because like what you and I do, we are businesswomen, we are entrepreneurs. Like, it's not like what you and I do, like that it puts the roof over our heads as well. But like the principle of caring about the people, and for me, caring about their fitness and making sure I have a space that people can come to and work out that is comfortable and allows them to actually get better and make their life better is more important, than how many people can I cram in here so I can go on a vacation later this year or something. Like, it's just, and I guess intrinsically that's just like a value that I was up with.
The other thing too is like, we're both proactive. So like, I would say that's priced into our rates too. Like, on a Saturday, I'm planning my Monday patients, or I'm following up with people if I saw them Thursday and they're new. And like, I've seen you before someone comes in, you're on your laptop programming for the next person versus, I mean, there are some private clinics and gyms where they'll be reactive and they won't have looked at anything because they're just milling people out, and they'll say, oh, what are we doing today? Or you can tell that they can't remember what they did with you last time because they're just there with you for the hour mentally. Like, I'm there before and after. You're there before and after, after hours, like thinking about how can I better serve this person? How can I make myself a better clinician or trainer?
Like, oh, these people have these limitations. Like, if you have somebody that's having neck issues, you're like, okay, well then how can I, assess that better? What tools do I have in the gym that I can help, what movement can I substitute now? Then?
What are we doing in the next 3 visits? I'll write that out after the first evaluation, just like a plan to kind of guide me instead of just reacting and being like, oh, I don't really know where I'm going with this, but I think we did this last time. It's like that when you go to the doctor's office, like their hour starts right before you come in. The medical assistant takes you back, and they're kind of, maybe they might look at what you're doing, or they're still in the office with another patient.
How many
and then they
times?
run in, and then they're like, hi, how are you doing? And then they're like, let me look at your chart. And you're sitting there quietly, and they're reading your chart, and they're like, oh, I see this and this and this. Oh, okay. Now I'm going to examine you versus we've looked at what we did with you before you even got here, and we know what we're going to do.
I know
we have a plan.
Yeah. It's so interesting to me. Like, how many times have you gone to a doctor's office and like you walk in, you tell this person your issue, and then they go back and you're like, they're going to tell the doctor what my issue is. So by the
and
time
then they ask you again.
Yeah. And then they ask me again.
You told 5 people.
And then by the time you get to the doctor, you're like, the doctor is going to know, like he's going to come in or she's going to come in. She's going to like freaking cannons firing, like ready to assess my problem. And then she's like, okay, so what brings you in today? And you're like, how have I told 7 people what is wrong with me, who have all expected to come to you with like their idea or this or the chart or whatever. And then you're still coming in to see me. And then now I'm going to self-diagnose for the 7th time what I think is going on. Like, it's just so funny.
When someone first comes in, they'll fill out an intake form, or I'll have talked to them on the phone, and I might still want them to explain like exactly what it is if we need, but I'll say, so I looked at your chart and I see it's left shoulder pain and you're having these symptoms, but can you tell me more? Because you can only write so much, but at least they know that I was prepared.
No, exactly. I have the way I program is I have tools where I can mark, like, if I have a client that, is nursing something with their neck and we're not going overhead, I can make that note. So, and I think this is like a nice way to tie in how we've collaborated on clients, because clients will come in and see you for an injury, or maybe they're working out somewhere else, or coming in to see you, they'll be with you, and then it's like, okay, well then what? Do you just throw them back to where they were, or like what's the next step there? And that's kind of where I think the handshake between SonMade Fitness and Stability and Wellness, I don't know what you want to call it. It's not a marriage.
Partnership?
The partnership.
Collaboration.
The collaboration, there you go. Between us, like, really, that's where it kind of grows and shines its light, is that now you can take this person and then, with their approval, you could share some of the information about their movement or their injury with me, share some rehab exercises with me, and then I get to put them into a program where they don't have extra homework now, but their prehab and rehab is integrated into some of the strength work that we're doing, or the warm-up that we're doing. So then we can progress them. Maybe it's eventually back to where they were doing group class, or maybe it's just personal training from then on out.
Well, and I'll email you like the home exercise program or like what you should maybe avoid or what you need to work towards. And I think also what's important is I think people are always afraid that if they start PT after they've had a trainer, or the trainer is sometimes afraid to refer to a PT because they're worried that they're going to have to stop seeing the client, or the client's worried that they're going to be told to not run for 6 weeks.
Yeah.
And I tell everyone that I don't tell you to stop doing anything unless you can tell me in the moment, like you're running and you immediately get feedback from your knee that it hurts, then maybe we should scale back on running for now. But if you can run without reproducing that knee pain, have at it, keep running. If you can keep working out with your trainer without having knee pain, because there's other things you can modify and there's plenty of ways to avoid it, then I don't need to take you out of personal training. But I think a lot of trainers are afraid and maybe try to hold on to someone and just kind of nurse the pain because they don't want to lose that client, because a therapist will say you can't work with that trainer anymore. But you're one of the few trainers, like you're probably the only trainer right now that I'll refer people to, because I know that you have a really similar approach to me, and you'll make it a safe space. You know what I look for and what to look for in people. And so I'm not worried about, is Whitney going to injure my client? Like, I don't worry about that with you.
No. And I honestly don't think that you should, especially like having like the relationship that we do. And I think that any PT and trainer should kind of try to create that relationship, because it's so beneficial for each other. And then it's really beneficial for the client. And one of the things that I really like that you do is that you definitely use pain as your guide. And that's the same way I would train somebody. Like if somebody's experiencing pain over and over and over again, like we're not getting to that point. Like I'm not going to screw your shoulder up. Like we're just not going to do that. And I'm going to say, okay, like you need to see Hanna about your shoulder. And if you don't, I can't fix it. Like I can do everything that I know, but I'm not a physical therapist. You need to see this person. And we're not going to do that exercise. I don't care if you want to get better at it. I don't care if you have a goal of doing, whatever it is. If it's the Arnold press that hurts your arm, we're not doing it until she sees you and gives me like the clearance that it's okay to do it. Because I can't tell you now if I'm going to make it worse or better. Like I can't just look at that. I didn't go to school. I don't know that for that. So, and I think that's kind of where I am with a lot of my clients, because the point of me training them is to keep them out of injury. So unfortunately, like for Hanna's business, I'm not just injuring clients left and right and sending them upstairs to get fixed.
You would not get them back if you were doing that.
So, she doesn't really get to see a ton of my one-on-ones because I try to keep them out of pain. But that also goes to show when something does arise, it's usually well out of my scope. And it's awesome to have somebody that I could just refer them to. And I know that I'm going to be able to work with them and know how to continue to train them and keep them healthy and keep them moving safely. I've tried to work with other physical therapists outside of SonMade Fitness, and it's always just like never aligned. Like what they're saying does not make sense. It's either like scare tactics and now my client doesn't want to move anymore, or like not addressing the problem, or just things that there's just not an alignment that I need.
We're not wanting to collaborate.
Yeah, we're not wanting to collaborate.
Oh, you do your thing, I'll do my thing.
Yeah. And then it'll be fine. And it's like, okay, well,
even though we're sharing a client.
We're both like trying to not control, but we're both.
You have the same goal.
Yeah. We have the same goal. We're trying to keep this person healthy and keep them moving. That's
the word we were looking for. We're a team.
We're a team.
Teamwork.
So we're a team now, but you also are stability and wellness. So do you want to go in a little bit of why you left, traditional physical therapy in the clinic, in the hospital or outpatient, and why the setup that we have together, or why a setup where you're more mobile, or in maybe my space, or I think you're in 2 other spaces in Jupiter area?
Yeah, I'm in like a triangle around Palm Beach County.
In your triangle?
I'm in West Palm Beach too. So
maybe just share a little bit about your why you are doing this whole new thing on your own versus just like being in one of those clinics.
Yeah, so I was in a stroke rehab clinic for the first 3 years of my career. It was like neuro rehab, pretty intensive. And it wasn't really the setting that I wanted to start in, but when I moved down here to be with my husband, there weren't a lot of jobs, a lot of great appealing jobs in 2019. So I started out there, but I'm really glad that I did because it changed how I treat my sports and ortho patients. Like I look at them like I do the neuro patients. And then I went into some outpatient at a hospital. And actually I got lucky because I've never worked in a mill. I was a student in a mill, but I've never actually worked in one.
What do you mean by mill? What do you mean by mill?
The 3 to 4 patients shared by the therapist an hour. There's like 12 patients in there, like 5 therapy assistants.
And would you say that is like a typical clinic, like a typical physical therapy clinic?
Yeah. So the mill clinics are usually orthopedic outpatient clinics, and the therapist will sometimes they'll see like 25 patients a day. So you go, how is that possible? There's only 8 hours in the workday.
I also know what it's like just
you are cramming them in.
Seeing 7 people a day and like the amount of energy expenditure and exchange that goes on with just 7. I cannot imagine. There's got to be some kind of like force field around you when you're seeing 20 to 25.
You just get burnout. They're churning out the patients and they're churning out the therapist.
Yeah.
So I got lucky because when most hospital clinics, they do one-on-one care, which I got really lucky that's all I did before I started my own business. So I have not had to suffer with the burnout in the mill. Yeah. But at the hospital, you're getting a lot of people who don't necessarily value their wellness. I think the way that the clients I see now do and the clients that you get, like it costs money to have good care and to like get good training. Like you're not going to be spending $20 on personal training. You're not going to be like, you think you're paying a $30 copay for therapy and that's what therapy costs, but that's not actually what is being billed to the insurance. Like they're billing a couple $100s to the insurance. So therapy doesn't really cost $30.
Yeah. And like, are they, and then in that instance, I always think, because I've been and done the insurance physical therapy, like, are you getting a $250 an hour treatment with that therapist?
No.
Well, no, I saw them for 11 minutes and like he rubbed my knee.
And then he told me to go do these exercises in a corner and I did.
And then he's like, and then he asked me if I did them last week and I lied and said I did. And I know I didn't. Like,
oh, were you the liar? You're the patient that lies?
No, I was not. I was the one who was like, I did the exercises and then I did all the stuff you told me not to do.
Yeah. The reason I shifted away from the traditional therapy was I don't know, something called to me about just like building something from the ground up for myself. Yeah. And I loved being an athlete. I played soccer for 20 years and working with athletes, they're motivated, they're dynamic, they're fun. And none of the traditional clinics really get a lot of athletes, you know, like they're looking for other types of clinics. So I was like, why don't I just start, you know, from the bottom up doing mobile and seeing like the market will dictate. If I'm good, then I'll take off, I'll fly. And if I just need to go back to a day job, then I guess I'll do that.
So you had like a little bit of like, well, this is always going to be here. If I want to do this, let me dive in and see if I can make this thing happen for myself.
Yeah. So, I mean, people go, oh, it started out as a side job. And it was only a side job for like 3 months. And then it was part-time. And so I was working part-time in outpatient clinic. So it worked out. I had 2 part-time jobs and one was mine. And then I wasn't really trying to build it because we were getting married. Sam and I were getting married and I knew I was going to go away for a month. And so I was nervous, like, well, I don't want to build this up and work hard and then just leave everyone. Or I was in my head about it. And so I probably started trying to market it like 10 months after I started it. And then within 3 months of like really hustling and trying, I went full time and quit the part-time job at the hospital. And I've been doing that for the last full-time year and a half, I think. But yeah, I think the other thing is that I left out was during COVID, I got dry eye and like a rash. I got rosacea in my eyes.
Wow.
And I was bouncing around from insurance clinic with the doctors and nobody could figure out or would spend more than 8 minutes with me to figure out what was going on. They were just pushing things on me that didn't work. And I found functional medicine that way. And it actually addressed the root cause. And so for a while I was working at the stroke hospital during COVID. I was like, oh my God, am I in the wrong field? Like maybe I should just go back to I should go to dietetic school and like get into functional medicine because like this whole root cause approach is super awesome. And like, it's really interesting. It just opened your
eyes to a whole different avenue of like, there's all these other solutions.
I didn't know that alternative medicine, like I didn't know anything about it.
I'm surprised that you had zero education on that. I mean, like you said, it's drinking, you know, when you're in PT school, you're drinking water through a fire hose, but I'm just surprised that there's no like...
PT school is Western medicine. based.
But there's no like acknowledgement of this other thing that, especially now, like we're all very interested in, because I mean,
I think social media has helped.
Social media has definitely helped. I think it's just like a turn of a tide of people being invested in themselves and like kind of knowing that, okay, all these conglomeracies are like trying to produce things as efficiently as possible, and like it could be poisoning me. So I need to just do a little bit more research and find out like what is going on. And it's crazy to me that you have this whole version of medicine being taught. It's like you're learning all of yin and then you don't learn any yang.
Yeah, that's a good example.
You know what I mean? Like, it's like and that's, I think, what
we were taught pharmacology, even though we don't prescribe meds, but we weren't taught nutrition.
Oh, 100%.
But we're supposed to teach people, we don't really, I mean, we're supposed to give them guidance on proper nutrition.
But you're not taught it.
No. So you reference like American Heart Society, like, if someone has gout, well, okay, let me go to the American Heart Society and like find a healthy diet. Like there's all these like blogs, like Cleveland Clinic has blogs, Mayo Clinic has blogs. Like I think in the hospital I was referencing stuff like that. And then with all the eye stuff and the functional medicine, like I got rid of the dry eye because the root cause wasn't like the outside of my skin that we were putting the antibiotic cream and the eye drops on. It was like something my inside. Gut. It was my diet and my stress, because COVID was like working in the hospital during COVID. So fun, stressful.
So stressful.
So it was like,
and opening your own business the next year.
And that's why I was like, I don't think I felt like I was making a huge difference treating the way we were
it didn't align with like your own values
in school. Yeah. I mean, it was just like, we're not really like, what is the root cause? Like we weren't taught root cause specifically, like not super in depth. And I felt like functional medicine was very root cause based. And then just along the way, when I was like, you know what, I don't think I need to switch careers. I think I just need to do my own thing and do it the way that I want to do it, because insurance forces you to treat inside the box. And I'm like a very out of the box thinker. Like I should be able to have a conversation with someone about their nutrition, or refer to like a functional medicine provider, or connect them with an acupuncturist if needed. Like there's just so many providers out there that can help address root causes, that if you're stuck in traditional therapy clinics, like you're never going to meet them. You're just going to stay on the hamster wheel of putting on the Band-Aid for the pain, and then the pain comes back because we never address the root cause. So that's why now
always there. Yeah.
It's really stimulating to my brain, I think, like selfishly. I'm like, you know what? I just enjoy treating this way.
Well, I
don't feel like I'm on a hamster wheel a work week.
You're in, and I honestly think it's why it lands on people, and why people actually get a result from visiting you, and why you have people who are even healthy or moving better or not in pain, they revisit you after, time away, is because it actually lands on them, because it's coming from like an authentic place from you. And it also actually works. It's a really good blend of all the things that you learned in Western medicine that are good, and with a nice sprinkle of Eastern medicine, and of actually getting to the root cause of something and actually making a change to this person's life, which does have an effect on them, versus nope, stay the same, be the same, move the same. Here's your Band-Aid. See you next week. And then, do that, till we move you into the assisted living facility, or you get like really horrible gut and you have to go to a different doctor because you're on so many pain medications or something. Yeah. I just think it's so interesting. This is like totally probably for another podcast, but just talking about all the things that you learned and didn't learn. I want to do like Hannah's post PT school education, like all the education you've given yourself since school, because you had to like heal yourself, heal your gut, heal your stress,
heal my hormones,
heal your hormones,
heal my knee,
all of that,
heal my jaw, like
heal my back, like all of those things. I think is like, so it's definitely a sidebar for another podcast topic, but it definitely has made you a better and amazing therapist. So I think that's part of the reason why things land with people.
Thank you.
Yeah.
I mean, they also teach us to be good generalists, but terrible specialists. Yeah. Like, I mean, now I'm like, this year I've started trying to put out more about my specialization in temporomandibular joint, or TMJ, pain and dysfunction, and the root cause of that being like a lot of myofunctional disorders. So that's the muscles of the tongue and the lips and the orofacial complex. I've been getting a lot of jaw pain patients, and I was like, oh, I can help these people. And then I come to find out, oh, the root cause isn't always the posture. It's not always the unstable joint. Like they might have restrictions at their tongue that's causing the problem. So like
that they've had since birth. They probably had that tongue restriction since they themselves were being breastfed.
Yep. So
or bottle fed.
There's just like there's so many different like rabbit holes you can go down with root cause to different conditions. And I really enjoy it. So what is your why?
Oh
tell the listeners about your why and your philosophy that shaped your gym and training approach.
Well, I think I talked a little bit about this on our first episode of kind of just how I came to even owning the gym. I was a competitive swimmer. I swam in college. I swam Division I. I swam all the way through Olympic trials. And when I was swimming, I was good enough to swim kind of like a multitude of events. And my best event ended up kind of like suffering because I was never really like specifically training for that. So when we would rest, it was just like this generic rest. And because I was doing certain relays or they needed me for certain events when I was on a team in college, I was never able to really like hone in and get like the kind of training I needed because I was training for an event that was 23 seconds or 22 seconds long and also training for an event that was 1 minute and 50 seconds long. So it was like, those are very different pain areas. And when I started doing CrossFit years later, I got taken under the wing of somebody who basically started writing me training for me, and I was like, whoa, I'm getting really good really fast. And there was all these other things that were taken into consideration. The fact that I've been an athlete my whole life, the fact that I'm on my feet coaching classes, the fact that I don't need to do, 1 million intervals on the rower because I have an aerobic background, the fact that my gap here is in my strength. I need to focus on this. So when I started to get really good with this like individual programming, I was like, this is whatever. This is the Qigong. This is the bee's knees. Like, this is great. Everyone should train like this, man. And it is expensive, but I'm getting a result. So it's
an investment.
Yeah. It's an investment.
It's not an expense. It's an investment.
Yeah. And so it taught me that investing in this type of coaching was actually creating a result. So then, I don't know, fast forward, I got injured. I injured myself. I was lifting incorrectly. I didn't know how to brace. And then I kind of got thrown into the PT world because I knew I needed to move still. I was like, I'm still competing. I'm still doing, CrossFit competitions. I'm still coaching. So I have to demonstrate movements. So I went and sought out a PT. And then that opened my eyes to like prehab exercises, rehab exercises, bracing, this whole conversation of all of these things that go along with weight training that I had no clue. To me, it was like such a perfect relationship of physical therapy and weight training, strength training, functional bodybuilding, functional movement, CrossFit, or, functional fitness, and even swimming. Like, I wish I had gotten physical therapy when I was swimming. And yes, of course, there were trainers. I went to, some big name schools. I was in the training room. I was doing ice on the shoulder, external rotation exercises, but whether it was maybe the lack of the why or that the trainers, in air quotes, that were working with us, maybe they lacked education, or maybe it was this mental space I was in. I was not able to absorb anything, but I just don't remember being impacted like that ever, like with physical therapy, until I hurt my back and was in this space now where I still needed to move. And so then that opened up my eyes of being like, okay, well, like, this doctor is giving me these movements as homework. I still need to do my workout. So I'm just going to start putting my homework PT or physical therapy exercises in my warm up, or I'm going to build it in as accessory to my strength work. So then I started training myself like that. And I was like, I'm staying injury free this way. Like, knock on wood at that time. But I was like, oh my gosh, I am doing these things and I'm staying injury free and I'm still lifting really heavy and I'm still training with a lot of volume. So these are just all like things like feathers in my cap. I'm just like keeping and putting in. So then, I start personal training people. I'm working with clients. I'm working with a client who is constantly showing up with something going on, like wrist inflammation, stomach inflammation, gout, can't do this. And at the time, I talk about reading this book. It's called Why Zebras Don't Get Ulcers. And at the time I was reading the book and I'm working with this client, and I'm like, I am overloading this client. Like, I'm overloading her systems. Alarm bells are going off all over the place. Like, I'm just going to put her through what I would call like low intensity workouts, and we're going to do strength training. So very specific, like functional bodybuilding and lifting, like the big three, I call them, like deadlift, bench, back squat, functional bodybuilding, and walking. And then all of these chronic things that were showing up for her just started to go away. And I was like, there's something to this. There's something to the stress in her life being too much, and the stress of like a high intensity interval workout, whatever we were doing before, being too much for her. So then that became a whole new avenue for me to add into like my personal training. And then the last thing is, like I really enjoy community. And I do think that that's what the one thing that group fitness does really well is they inspire community growth. And so as I'm doing personal training, I'm noticing like that's missing. The sense of community is missing. It's a lot of one-on-one, but the sense of like, we're all in this together, the sense of building bonds, the sense of getting to know somebody else or know another business or network, it all wasn't firing on all cylinders. So having a gym space and having people that are allowed to come in and do maybe just their own thing or open gym allowed me to still be in touch with the community aspect. And then fast forward, after owning the gym a couple of years, now I've really done a dive into community growth. And now I have like a community class, which is really cool. So my why, my why is the gym's why, right? It's to train for having a capable body, training for longevity, and strength training being part of your insurance for aging, aging well, aging healthily.
Do you want to talk about, I kind of want to talk about real world examples too, of like clients we've shared that have transformed from like being in pain to now just full on strength training with you, like pretty unlimited.
Yeah.
So I had this client who initially came with neck pain, headaches, jaw pain, and wasn't able to do any normal activity because that stuff can just be really disorienting and cause a lot of issues if you're going to try to lift. So we just started out as a patient-provider relationship and started getting to the root cause of the issue. And she knew that she didn't want to go back to one of the Globo group fitness gyms in the area because that probably wasn't going to be the safest or best for her. And she wanted to get back to some semblance of working out. She wasn't sure if she wanted to go back to that one or not. And so I had said to her, like, when we start progressing to lifting heavier and doing more with exercise for your upper body, I want you to at least schedule a consult with Whitney so that she can see what's going on. And she if you want to go back to the Globo group workout, like at least use Whitney as a bridge if that's a goal. And I think she's like, I don't ever need to go back to that place. I'm going to do personal training with Whitney because it matters and it keeps me safe and I'm getting stronger and stronger. Like now she was afraid to like back squat or lift overhead with you and I think she did it.
Yeah, we've done. Well, she was actually just afraid in general. I don't even want to use afraid, and I don't want to use the word
hesitant.
I don't even. Yeah, I want to say triggered, but I'm not. I don't want to say triggered. But when I got the barbell out, it was like almost PTSD for her because she associated that with high intensity, with heart rate through the roof, with body feels like glass, with I don't want to touch that. It's going to hurt me.
When she comes so far to not having pain.
So as soon as she saw that, she was like, I don't want to. So then, when we started, I was like, all right, we don't have to use this today. It's a tool, right? It's like, it's just a tool to use. There's other tools we can use to get a really similar stimulus. So then, fast forward, I don't know, like 4 sessions, I got the barbell out again. And I was like, look, this is what we're going to use it for. We're going to do some box squats. So I like using box squats. I like using the barbell for them because it's loading your back. You're learning how to brace. You're learning how to stop and go. So you have to create explosivity through the bottom position of your squat. You have momentum that's like cut off. So there's just like a lot of good things when you do a box squat, and like really the best kind of stimulus is with maybe even a safety bar or a barbell. So we got the barbell out to do that, and she did them. It was really cool because not only is she doing something great for her body by, practicing this movement and doing it correctly, but she did something really great for her brain by overcoming this fear of, I can't use a barbell, it's going to hurt me. And I wasn't ever going to put her in a place where she was going to get hurt, but it was just her association with it. So it's like she overcame this thing psychologically, and now the barbell can come out. We can do landmine work with it. We can do deadlifts. We can do RDLs. We can do all these things, and she's not like emotionally jarred by just seeing it out on the floor. And slowly but surely, like as you start strength training and doing some form of, increasing your overall fitness, you do find yourself able to access a little bit of deeper gears. So at the end of our session the other day, it wasn't an easy session by any means. We did a very focused like strength training piece where we did some jumping and some squatting. And then we went outside and we did low intensity, high intensity sled work. Something that she's like, she would have been like, no way, I am not doing that. And we went outside and she was able to like low intensity push the sled and then high intensity sprint with the sled. And it was really cool because I think one of the things that gets lost in training is the ability to sprint, especially for females over 35. So for me, being able to work with her and sprint in this high intensity thing, when she was so fearful of it, it was just a big win. It was a big win for me and it was a big win for her. And it was because we like carefully approached her training with, Hannah's guidance. And then in every warm up, what I like to do is I like to introduce like posture things for her and neck things for her. So she's like it's already like tuned into her head. Cues, me cueing her head back, me cueing her when she's moving during the workout. So she's constantly getting that good feedback for, continuing through her workout,
Yeah, that makes sense.
Yeah. But yeah, that was a win. That's such a good example of a client that we share that has really made progress by revamping their health and fitness.
Well, and we still share because like you said, like she's continuing on with normal training for you, and that's what with you, and that's what she needs. And she's coming in monthly just to maintain wellness, just to make sure she stays good. Because again, we don't want pain to be the last thing we feel and be like, okay, well now I'm going to take care of it when we could possibly prevent something from coming up because we caught it with a maintenance session.
Yeah.
So that's something that I also forgot to add is it's not just physical therapy. Like, yes, I have physical therapy services, but I have the whole wellness services. That's why the business is called Stability and Wellness.
Yeah.
So we have a whole slew of wellness offerings as well.
What are some of them?
I was like, do I want to list them off?
Yeah,
okay,
what are some
I guess
of them?
I'll list them off.
What are your wellness offerings?
So right now we offer mat and reformer Pilates because one of my old classmates, Andrea, is doing some work for me. So she's Pilates certified. I offer a lot of craniofacial wellness treatments. So dry needling, facial cupping, craniofacial, not craniosacral, craniofacial. So head and neck massage. I don't really do performance training like you do, but I will offer kind of like bridging the gap of, okay, you're pain free. Like let's start doing more performance-y based things. But then when they want to start doing heavy lifting and personal training-esque things, I defer to Whitney. And I also offer recovery visits. So sports massage, body cupping, scraping. I think that's it.
That's awesome.
There might be more in the future. We'll see.
I think that's the one good thing about where we're at in both of our kind of journeys as business owners is that we're always
it'll evolve.
Yeah, and we're always like educating ourselves deeper and evolving, our practice to try to have it make more sense to, the point is to have more healthy people on the planet, but not more sick people on the planet.
Well, and like we're aiming for true wellness, not trendy wellness.
No.
True wellness. And I think that's something that the trendy wellness is more of like a Band-Aid thing or a Band-Aid aesthetic, like short-term gains versus like forging deep, meaningful habits with changing the way you move and the way you view food or any habits you have.
And the way you are self-aware of your movement, not just in the gym, but outside of the gym.
In life.
we're not just about working out, but we're about building strong, mobile, capable, healthy humans that can move more and worry less,
Beautifully said. Did you say that, or did the old chat GPT?
No, that's been my move more, worry less. Move more, worry less has been my little, before I had worst hour of your day. That was kind of like my little hashtag.
Before chat GPT
before my brain turned into a computer. Yes, absolutely. So, and Stability Wellness is more than just a clinic, right?
Oh yeah, we are more than just a clinic. We are your wellness partners. So I think the takeaway message that we want the audience to hear today is for Stability and Wellness and SonMade Fitness is it's whether you're just starting out or bouncing back or chasing performance, your program or your therapy should meet you where you are.
Yeah, for sure. It should definitely meet you where you are, not make you meet where the program is, I guess.
Or make you stop doing the thing that you love doing and, hitting a reset button and doing therapy laying down on a table and then putting ice on that body part.
I definitely would.
What are your goals? What's going to resonate with you?
That would raise an eyebrow for me. If I was in a place and they told me to stop moving, I would probably just leave.
Yeah, you should.
Yeah.
You should just leave if they say that to you.
All right, guys, move more, worry less. We're out.
All right. See you guys next time.
If you're local to Jupiter, come see the space or shoot us a message. And remember to rate and subscribe to the podcast. We'll see you next time on
Beyond the Reps, what your trainer and physical therapist forgot to tell you.